Good evening and welcome. If you're over 60 and you find yourself waking up 1, 2, or even 3 times a night to use the bathroom, you're certainly not alone. Many people assume it's simply an unavoidable part of getting older, or that the bladder is entirely to blame, but the reality is often more complicated. Nighttime urination, also called nocturia, can have several different causes. Sometimes it is related to the bladder or an enlarged prostate. Other times, it may be connected to medications, heart or kidney conditions, diabetes, sleep apnea, or even the way fluid moves through your body during the day and while you sleep. Understanding the real reason matters, because the right solution depends on the cause. I'm Dr. Kalvin Stone, and for many years I've worked with older adults who were frustrated by interrupted sleep. One of the questions I hear most often is, why do I keep waking up when I didn't even drink that much water before bed? Today, we'll look at 3 evidence-informed strategies that may help reduce nighttime bathroom trips for many adults over 60. We'll also discuss when frequent urination is a sign that you should talk with your healthcare provider rather than simply trying home remedies. Let's begin with a question that surprises many people. If you wake up and pass a large amount of urine during the night, what does that actually tell us? Many people assume it means the bladder suddenly became overactive. But if your bladder is full, another possibility is that your kidneys produced a significant amount of urine while you were asleep. That shifts our attention from the bladder to the body's overall fluid balance. During the day, gravity naturally pulls fluid downward. If you've ever noticed mild swelling around your ankles or lower legs after standing or sitting for several hours, you've seen this process in action. Small amounts of fluid can collect in the tissues of the lower legs, especially as we get older or if we spend much of the day sitting. When you lie down at night, gravity is no longer pulling that fluid towards your feet. Some of it returns to the bloodstream, where the kidneys can filter it into urine. For certain people, this process contributes to producing more urine overnight. This doesn't explain every case of nocturia, but research suggests it is an important contributor for many older adults, particularly those with swelling in the legs. Here's a simple observation you can try. Before bedtime, look at your socks. Do they leave deep marks around your ankles? Do your shoes feel tighter in the evening than they did in the morning? If you gently press over your shin for several seconds, does the skin stay indented briefly? These signs don't diagnose a medical condition by themselves, but they may indicate that fluid has accumulated in the lower legs during the day. If that's happening regularly, it's worth mentioning to your healthcare provider because the swelling could have several possible causes, ranging from prolonged sitting to circulation problems, certain medications, or underlying heart, kidney, or vein conditions. This leads us to the first practical strategy. Fix number 1. Help your body move fluid earlier in the evening. One of the simplest approaches is to avoid staying seated for hours after dinner. A gentle walk, even for 10 to 20 minutes if your health allows, helps the calf muscles act as natural pumps, moving blood and fluid back toward the heart. If walking isn't comfortable, simple seated ankle pumps or gentle leg movements may also encourage circulation. For some individuals, elevating the legs for a short period during the evening can help shift fluid before bedtime rather than after falling asleep. If you have heart failure, kidney disease, or another chronic medical condition, ask your healthcare provider whether leg elevation is appropriate for you. Notice that none of these suggestions involve drinking less water all day. Many older adults intentionally become dehydrated because they're afraid of waking up at night. Unfortunately, that can create new problems. Dehydration may contribute to dizziness, constipation, urinary tract infections, and confusion, especially in seniors. Instead of dramatically restricting fluids, many healthcare professionals recommend staying well hydrated during the daytime, while discussing with your clinician whether adjusting the timing of evening fluids makes sense for your individual situation. But fluid movement is only one piece of the puzzle. There's another factor that many people never consider: one that can quietly increase nighttime urine production, even when your bladder itself is working normally. And that's where our second fix begins. Before we move to the second fix, it's important to remember one thing. Waking up to urinate is a symptom, not a diagnosis. The goal isn't simply to make nighttime trips less frequent, it's to understand why they're happening in the first place. That brings us to the second fix. Fix Tac 2. Pay attention to blood sugar and evening eating habits. Many people are surprised to learn that what happens after dinner can influence what happens while they're asleep. As we age, our bodies often become less efficient at regulating blood sugar. This doesn't necessarily mean someone has diabetes, but it does mean the body may handle large evening meals, especially those high in refined carbohydrates or sugary desserts, less effectively than it did years ago. When blood glucose rises significantly, the kidneys may begin removing some of that extra glucose through the urine if levels become high enough, because glucose pulls water with it. This process can increase urine production. This is one reason frequent urination, especially when combined with increased thirst or unexplained weight loss, can sometimes be an early sign of diabetes and deserves prompt medical evaluation. Even for people without diabetes, very large, late-night meals may contribute to poorer sleep quality and changes in nighttime metabolism. So instead of focusing only on what you drink before bed, it may help to look at what and when you eat. Here are several habits that many healthcare professionals recommend. Finish dinner at least 2 to 3 hours before bedtime, whenever practical. Limit large portions of sweets, sugary drinks, and refined carbohydrates late in the evening. Include protein, healthy fats, and fiber with dinner to support steadier blood sugar after meals. Avoid making late-night snacking a daily routine, unless your healthcare provider recommends it for a specific medical reason. These aren't miracle fixes, and they won't eliminate nocturia for everyone, but they support overall metabolic health. And for some people, they reduce one contributor to nighttime urine production. Another benefit is that these habits often improve sleep quality itself, and better sleep can make occasional nighttime awakenings less disruptive. Don't overlook your medications. Now let's talk about something that's easy to miss. Sometimes the bathroom isn't the real problem at all. It's the medicine cabinet. Several commonly prescribed medications can increase nighttime urination. One of the best-known examples is diuretics, often called water pills, which are used to treat conditions such as high blood pressure, heart failure, or swelling. If a diuretic is taken late in the day, it may still be encouraging your kidneys to produce urine during the night. Certain diabetes medications can also increase urination as part of how they work. Other medications may affect sleep or bladder function indirectly. That doesn't mean these medicines are bad. Many are extremely important and provide significant health benefits. But if nighttime bathroom trips began after starting a new medication or became noticeably worse, it is worth discussing the timing and dosage with your healthcare provider. Never stop or change a prescription medication on your own. Sometimes, a simple adjustment in when a medication is taken, if medically appropriate, can make a meaningful difference. Sleep disorders can play a role. Another frequently overlooked cause is obstructive sleep apnea. People often associate sleep apnea with loud snoring, but it can also contribute to nighttime urination. When breathing repeatedly stops and starts during sleep, the heart and lungs experience changes in pressure that trigger the release of hormones, encouraging the kidneys to produce more urine overnight. If you wake frequently to urinate, and you've been told you snore loudly, gasp during sleep, or feel exhausted despite spending enough time in bed, it's worth mentioning these symptoms to your healthcare provider. Treating sleep apnea can improve overall health and, for some people, reduce nocturia as well. At this point, you can probably see why there's rarely a single explanation. For one person, the main issue may be fluid pooling in the legs. For another, it could be poorly controlled diabetes. For someone else, medications or sleep apnea may be the biggest contributor. Finding the correct cause is often the key to finding the right solution. In the next section, we'll cover the third fix, a simple evening routine that may help many adults over 60 reduce nighttime bathroom trips while also improving circulation and preparing the body for a better night's sleep. We'll also discuss the warning signs that mean nocturia should never be ignored, and when it's time to seek medical evaluation rather than trying home strategies alone. Now let's look at the third fix, one that doesn't require expensive equipment or complicated routines, but can make a meaningful difference for some older adults. Fix number 3. Create an evening routine that supports better fluid balance. Many people think the best solution is simply to stop drinking water after dinner. While limiting large amounts of fluid right before bed may help some individuals, severely restricting fluids throughout the evening is usually not the answer. In fact, dehydration can create its own health problems, especially after age 60. Instead, focus on helping your body manage fluids before you go to sleep. A simple evening routine might include taking a gentle 10-20 minute walk after dinner if your healthcare provider says it's safe for you, avoiding long periods of sitting without moving, elevating your legs for 20-30 minutes in the evening if you tend to develop ankle swelling and your doctor has not advised against it, emptying your bladder just before getting into bed, keeping a regular sleep schedule, since poor sleep itself can make you more aware of the urge to urinate. None of these steps guarantee that you'll sleep through the night, but together they may reduce one or more factors contributing to nocturia. When is it time to see your doctor? Although waking once during the night becomes more common with age, frequent or sudden changes should not simply be dismissed as getting older. Make an appointment with your healthcare provider if you suddenly begin waking multiple times each night without an obvious reason. You notice burning, pain, fever, or blood in your urine. You're constantly thirsty or losing weight without trying. Your legs are becoming increasingly swollen. You have shortness of breath, chest discomfort, or rapidly worsening swelling. Nighttime urination is causing repeated falls, severe daytime fatigue, or affecting your quality of life. Your clinician may recommend tests to evaluate possible causes such as diabetes, urinary tract infection, kidney disease, heart problems, prostate enlargement, overactive bladder, or sleep apnea. Remember, nocturia is often multifactorial, meaning more than one issue may be contributing at the same time. The bigger picture. One of the biggest misconceptions is believing that everyone who wakes up to urinate has the same problem. That's simply not true. For one person, improving circulation during the day may help. For another, better blood sugar management may make the biggest difference. Someone else may need treatment for sleep apnea or an adjustment to medication timing, and another individual may have an enlarged prostate or an overactive bladder that requires medical evaluation and treatment. That's why it's so important not to rely on internet advice alone if your symptoms are persistent or getting worse. 3 takeaways to remember. If you only remember 3 things from today's video, let them be these. First, don't automatically blame your bladder. Nighttime urination can begin elsewhere in the body, including changes in fluid distribution, medical conditions, medications, or sleep disorders. Second, healthy evening habits, such as regular movement, sensible meal timing, and avoiding heavy late-night eating, may help reduce nighttime trips for some people while supporting overall health. Third, persistent nocturia deserves attention. It may be one of the body's earliest clues that something else needs to be evaluated. Small changes, practiced consistently, often have a greater impact than searching for a quick fix. If you found today's information helpful, I hope it gives you a better understanding of why nighttime urination happens and encourages you to have a conversation with your healthcare provider if it's becoming a regular problem. Thank you for watching. And remember, healthy aging isn't about finding miracle cures. It's about understanding how your body changes over time and making informed decisions that help you stay active, independent, and well-rested. If you enjoyed this video, please consider liking it and subscribing for more evidence-based health information designed specifically for adults over 60. And if there's a topic you'd like us to cover in a future video, let us know in the comments. Until next time, take care of yourself and have a peaceful night's sleep.